Trying to figure out if therapy is right for you and your child? Most therapists offer a free consultation to ask questions before starting therapy. I myself like to use that time as a therapist to provide information to the individual so they can make informed decisions that will meet the needs of their child. In this video, I provide questions to ask under the categories of Can you help me? Qualifications and experiences, and Need to know. Hi and hello. Welcome to Nurturing Youth Counseling. I'm Colette, a licensed professional counselor partnering with you in your child's social and emotional development. I answer questions about children's mental health and provide skills that I learned while in private practice and with my own children. Come journey along with me on this roller coaster ride of life that we call parenting. As I said before, I tend to group the questions you would ask a therapist before therapy into categories. The Can you help me category should tell you how the therapist can meet your child's needs. For example, my child has been fill in the blank, feeling anxious, tense, depressed, angry, having problems with school, friends, sleeping, eating. What experience do you have helping people with these types of problems? What type of therapy do you recommend for my child? Is it effective for treating my child's concerns? Research tells us there's specific types of therapies that work best for certain types of issues. An example of this is ERP, which is considered a gold standard for treating people who have symptoms of OCD. The therapist should be able to describe one or more types of therapy that would work with your child's concerns, as well as its effectiveness. Make sure the therapist has specific experience for your child's particular problem to determine whether they can help. Along the same lines, ask, what should I expect from a typical session? Does each session start with a recap of the last session? Do you chat for a little bit before diving into the issues? Do I participate in my child's therapy? This is where you can find out how the therapist runs their sessions and keeps on track, what the plan is moving forward to meet your child's needs. Not every therapist includes the parent in a session. My preference is to include the parent in the child's session. Stay tuned for a later video explaining why. How long will therapy last? Weeks? Months? Years? The duration of therapy can differ depending on the issue at hand. While there may be no way to pinpoint exactly how long the treatment will take for your child, the therapist should be able to give you a general estimate based on their experiences with that type of concern. Qualifications and experiences category should tell you more about the therapist. Think of this category as you being the boss and interviewing the therapist to find out more information. Are you a licensed therapist? Are you licensed for this state? What licenses and certifications do you have? Do you belong to any professional organizations? The therapist should have a master's or doctoral degree in a mental health field, one that provides intensive training in psychotherapy. Don't worry about the letters at the end of their name. What matters more is that they're a licensed mental health professional, meaning they received the appropriate training. Outside of the licensing board, it can be helpful to know if the therapist is in any other organizations, because it can show a dedication to their craft. Therapists begin with general training, and as they continue to practice, they find areas of specialty that they excel at. Ask the therapist, what are your areas of expertise? For example, some therapists, like myself, may specialize in children, while others may focus on marriage counseling, career counseling, or substance abuse counseling. How many years have you been practicing, and are you under supervision? It's common and expected for newly licensed therapists to be under supervision for a year or two. Understand how many years of experience a therapist has can help gauge how much knowledge they may have in addressing your needs. The Need to Know category should provide basic information to help decide whether or not to schedule an appointment. Just because a therapist accepts insurance doesn't mean they accept your insurance. What insurance providers do you accept? The therapist will be able to tell you whether or not they accept your insurance, but may not be able to provide you with specific details, such as if your plan requires you to meet a deductible before coverage kicks in, or that you have a copayment at each session. If the therapist doesn't take your insurance or is self-pay only, you need to know about their fees. What are your fees, and do you have a sliding scale? Fees play a big role in determining the frequency of appointments or even if you can move forward with the therapist at all. If you have out-of-network benefits, you may still be able to get some coverage or reimbursement for appointments. Make sure to ask a therapist if they can provide statements for you to submit to your insurance company. Many approaches to counseling may include medication. In fact, sometimes it's the combination of therapy and medication that's most effective. Are you qualified to prescribe medication? Some therapists, such as a psychiatrist or a psychiatric nurse practitioner, can, but other therapists will tend to refer you as the need arises. Sometimes life happens, and it's nice to know if you're going to have to pay extra for it. What's your cancellation policy? Find out about the procedures of notifying the therapist when you need to cancel. Sometimes there is a fee for not showing up or canceling without sufficient advance notice. Congratulations, you did it! You interviewed a therapist! Hopefully these categories of "Can you help me?", "Qualifications and experiences", and "Need to know" help you determine if therapy is right for your child before starting therapy. If you're having difficulty locating a therapist, check out my 5 fab ways to find a therapist in the description box below. Please be sure to like, subscribe, and drop a comment below if you found this helpful. This video is not intended as legal advice, nor should it be used as a replacement for mental health therapy. Also, I'm not a medical professional, so please be sure to seek the appropriate individuals should you need them. As always, thank you for watching, and until next time, don't forget to breathe and enjoy this roller coaster ride of life that we call parenting.